Welcome to Kenton's videos. Enjoy the video.
You start by washing your hands and inspecting the Nazomac F bottle. This prevents infection and lets you check the nozzle. Once ready, shake the bottle 5 to 10 seconds so the suspension mixes evenly. Next, remove the cap and prime the pump with 1 or 2 test sprays away from your face if it's the first use or unused for several days. Priming ensures the correct dose. Make sure you're upright and breathing normally as you prepare to administer the spray. You now position yourself. Stand or sit upright and tilt your head slightly forward so the spray reaches the nasal lining rather than the throat. Next, close the opposite nostril with a finger and insert the nozzle just inside the nostril, pointing toward the outer ear, not straight up. Begin a gentle inhalation, and as you breathe in, press the pump firmly once to deliver the dose. Repeat for the other nostril, if prescribed, and then breathe normally to let the You finish by wiping the nozzle with a clean tissue and replacing the cap to keep the spray clean and functional. If you feel excess dripping, pinch your nose lightly and exhale through your mouth. Avoid blowing hard for a few minutes so medicine can absorb. If the nozzle clogs, remove it, rinse under warm running water, shake, and reprime with 1-2 sprays. Never use boiling water. If you experience severe irritation, nosebleeds, or no symptom improvement after the recommended period, contact your healthcare provider.
Thanks for watching. Consider subscribing if we helped you.